We begin at 6 with that new warning from the CDC to be prepared for the coronavirus to spread here in the United States. Officials say it's no longer a matter of if it will happen, but when it will happen. I'm David Wade.
I'm Lisa Hughes. Right now, there are 80,000 cases worldwide. The U.S. only has 53 confirmed cases, including one in Boston. But as WBZ's Paul Burton explains, experts expect there will be more, and this virus spreads quickly.
The Centers for Disease Control and Prevention said today it expects coronavirus to spread in the United States and asks Americans to prepare.
It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness.
Dr. Paul Benninger is the director of MGH's Center for Disaster Medicine and the Chief Division of Emergency Preparedness. He says they have policies in place to identify, isolate, and hospitalize people when needed. The biggest concern is that there's a large outbreak.
Ultimately, if there are a large number of patients, we have to have contingency plans for even more space. So, for example, here at the hospital, we have one entire floor that we can turn into a negative pressure floor if we have to.
There have been more than 50 confirmed cases of coronavirus in the United States so far. President Trump downplayed the crisis during a state visit to India.
The people are getting better. They're all getting better. I think that whole situation will start working out.
Despite the assurance, senators of both political parties are questioning whether the White House's request for $2.5 billion is enough to prepare the United States for a possible outbreak.
If you lowball something like this, you'll pay for it later.
The dollars will come if the plan is there, but we're not just going to give the president dollars that we don't know what he's going to do with.
Dr. Benninger says it's important for people not to panic, but they should do all they can to protect themselves from the coronavirus.
It may be that this virus comes to the United States and is in the community. It's also important they understand how they protect themselves. Wash their hands frequently, avoid touching their face, cover their cough. Those things really help.
And doctors here at MGH say they're working closely and constantly being updated by the CDC and the Mass Department of Public Health. They say the best source of information is to check out the CDC website and be careful what you're reading and watching on the internet. Reporting in Boston, I'm Paul Burton, WBZ News.